I'm Miss Wall, and we're going to be demonstrating how to break down the dental unit after you've done patient treatment. So we're going to go ahead and get started. I'm going to wash my hands first. I have my PPE on already from seeing the patient, so I don't need to put the PPE on, but I do need to wash my hands. Let's get that done. And there's a certain area and a certain way you break the unit down, just like when you set it up. You have to disinfect it again because now it's contaminated after patient treatment. Remember I said you're going to be washing your hands a lot? Yep. Lots of sanitizer though. Like I said, if ever in doubt, sanitize. My hands. And Ms. Turner, what is our next step?
Our next step is going to be to get the utility gloves from under the sink.
Okay. And I have clean hands so I can open the door. And grab our utility gloves. Do we don them?
Yes.
Okay. And I'm going to pull out the disinfectant before I put my other glove on because I don't want to contaminate it. If I can get my hand in here, it's still wet. Let me dry it out a little more. I'll use somebody else's gloves. I just dropped that one, so I'll use this pair.
Okay.
I'm sure hopefully they won't mind if I use the protective.
No.
Don't want to use that one because I dropped it on the floor. So I'm going to just borrow someone's here. Now let's see if I can get it on. I'll make sure and put them back where I found them because they are not mine. Oh, there we go. Much better. All right.
Okay.
Oops, hang on. Let's take this out first. Close the door. And then I'll put my other glove on. All right, next.
Now we're going to get our silver tray from the mobile cart shelf and place it on top of the cart.
Here's our silver tray, and we're going to place it up here.
Now we want to make sure any sharps that we used are placed in the sharps container.
As you can see, between the different partitions, there are red containers, and this is where your sharps will go, but I believe the dentists are in charge of the sharps and anesthesia, but just so that you know that they are there. Okay.
So now we want to return all of our instruments to the cassette.
Okay.
And secure the cassette.
Trash here. And our instruments are in there. We want to make sure that we don't have anything sticking out that will stick somebody. So we want to make sure and have all the sharp instruments on the inside, all the points, so that they aren't sticking out of the little holes. And we're going to close it up.
Place it on our silver tray.
Close it up tightly, and we're going to put it on our tray.
And then we're going to discard the blue wrap from our tray.
Okay, so now we're going to take our blue wrap off. Please don't leave tape on the bottom of the bracket table. It's unsightly for the patient. They can see under there a lot of times, and you just want to make sure and get the tape off. So what you want to do is make sure that your entire piece of tape comes off so that you don't leave any underneath. You can throw that away.
Now we're going to remove our saliva ejector.
Okay.
As well as the holder.
And we didn't lose that, thank goodness. Didn't fall on the floor.
We're going to run that for 30 seconds with the water.
And I think we're out of water, but we would run it for 30 seconds. We would run the water just like I showed you before without it touching. So just pretend that was 30 seconds.
Okay. Now we're going to remove the metal saliva ejector holder.
You're going to take it off at where it adjoins the hose. You're going to take the whole thing off. like so. And usually what you're going to do with this is you're going to wrap it around a little bit so that it doesn't fall on the floor while you're disinfecting. Like so.
We're going to
And
place.
you want to take this apart. It's in two pieces, so you just unsnap it like that. And you set that on your tray.
Now we're going to transport our instruments and.
Okay, so what we would do is we would go up to the dirty side. This would be open. And we would transport our instruments to the dirty side and then have the clinic assistant or the dental assistant take care of that for us. Okay.
Now we're going to remove and discard the air-water syringe tip.
Okay, that would be this. So we're going to pull that off and throw it away.
Next, remove all barriers and place in the trash can.
Okay. I like to take the big barrier and put the smaller ones inside of it and then throw it away in the trash can that way. But you can take them off individually if that's your preference. So you take your big bag and you can put your barriers in it. I know I turned it in so I'd be able to get it off easily, but it's on there pretty good. There we go. This is really sticky. I find it's kind of hard to get off, but it will come off with some persistence. And we'll take it off with the switch. Perhaps we'll take it off the switch. There we go. Like I said, it's really sticky. Okay, let me set this down. Sorry about that, guys. All right, here we go. All right, just persistence. It's got to come off. Okay, so we got that. We got the monitors handles, so we're going to do that. Same thing. Like I said, you can put it in a bag or you can throw it right in the trash. Anything that you use in your unit while you're working on your patient, put in your unit trash, not in the big trash cans. Please. Okay, we'll get our headrest cover. And we'll come over to our assisting arm. And we'll remove that. And we have a couple more barriers. Barriers on our keyboard and on our mouse.
And the handles on the operator and assistant chair.
Okay. Thank you.
You're welcome.
Can't forget these. These are easily forgotten. I say that because I know I've done it before. Just don't even think about it. And I think we have one on the other chair.
Yes.
All right. And I think that takes care of our barriers.
Okay. Next, we're going to wash the utility gloves with soap and water while we're wearing them. And then we're going to remove one glove. We already have our disinfectant, but we'll get the suction cleaner also.
I'm going to show you the suction cleaner, but we're not going to actually do it. We'll show you how to do that as part of your clinic course. But I will show you what it looks like and where it's located. Because I don't want to contaminate the door, I'm going to take off one of my gloves. And it's in this container. You see with the little knobs on top of it? That will be run through at the end of the day. And we'll talk more about that in clinic. Put my glove back on. And what's next?
So now we're going to start our wipe, discard, wipe.
Okay, we're going to do the same thing. We're going to do it twice, just like we did before.
And we'll begin with the soap dispenser, hand sanitizer, disinfectant container, and sink top.
Just like the order was before. Try to keep the order the same. That way it's easier to learn.
Okay.
And what next?
The operator and assistant chairs, the handles and backs only.
Again, we don't want to use it on the upholstery. Okay, let me get the other one. We have a handle on this one. Okay. All right.
Now the assistant arm.
Okay. Pull this off so we can clean it really well. Now the areas that you had barriers on, you don't have to spend a lot of time on with your disinfecting because you had barriers there, and that was the purpose of having the barriers. You still have to disinfect, but you don't have to spend as much time as you did when you disinfected initially.
And we're going to clean the tubing as well.
Okay.
And those.
Tubing.
And if we had the suction cleaner out, we would wipe the outside of it as well.
Okay. That will be done at the end of the day.
Okay. The back of the patient chair headrest and knob.
Okay. See, we're doing the same thing that we did before we treated the patient. We're just getting some of the areas that we did previously.
Right, mobile cart, top and edges.
And we can put our mouse in the drawer when we're not using it and make sure it's turned off. There is a switch on the bottom that you need to make sure it's turned off so that we can conserve our batteries. Okay.
And the master control unit. We'll do the handpiece connectors, tubing, air water syringe.
Just like we did before. Okay.
And the extension arm.
And the extension. Okay, which is the arm here. Okay, what do we have next?
Dental light handle and the switch.
Okay. Switch. Next.
And computer monitor handles.
Again, we don't want to do the screen. And we had barriers on these, so we don't have to spend a lot of time disinfecting.
And if we had our clipboard, blood pressure cuff, and
We would be
stethoscope.
disinfecting those as well at this time.
Okay.
Okay.
So now we're going to remove our eyewear with a paper towel.
Okay. And we need to do this again.
Oh, you need to do your second.
Yeah, we
Sorry.
need to do it a second time. It's all right. One more time. Wipe, discard, wipe. Same order, same items. Okay, what's next?
Operator and assistant chairs.
Okay. Here, do this one.
Okay. Then the assistant arm, including all holders and tubing.
Okay. See if we can get this untangled a little bit here.
Okay. Mobile cart. Actually, do the patient chair headrest first.
Alright.
And now the mobile
Cart.
cart.
Top and
Edges.
edges. Okay. Alright, what's next?
Master control unit.
Alright. Get another towel. Like I said, you want your towel to be wet because then it's working. If it's dry, then you're not getting any disinfectant on your unit. It's not going to do any good. And then it's going to dry, and that's how it works. So you want it to be wet because you want to see it dry.
And the extension arm.
Okay?
Light handles and switch.
Alright,
And
monitor handles.
Mhm.
Okay. Trying to remember the order a little bit
Mhm.
here. Okay, next.
And now we can remove our eyewear, paper
Okay.
towel.
So we've done our 2-time disinfecting so we can
Just a paper towel between the utility
Right.
gloves.
and the eyewear.
And then we're going to wash our safety glasses with soap
Pull
and
these
water.
off. We're going to wash them.
And then place them on a clean paper towel to dry.
Start this one out. So we're going to put some soap on it. And wash them really good because we've got spatter and debris and that sort of thing on them. So you want to make sure you clean them off really well. Rinse them off. And put them on a towel to dry. You want to make sure that your safety glasses you have you can wash, that they're washable. Otherwise, you're not going to be able to use them. Then we usually just put a paper towel up here and set our glasses on the towel.
So now we're going to secure our trash.
Okay. So we're done getting all the barriers and everything off, so now we're going to get our trash bag, and we're going to tie it a little knot. Try and get some of the air out because there's a lot of bags that have to go in that trash can. I'm going to tie it in a knot, secure it, and then I'll walk you over to where we throw them away. We don't throw them in our clinic trash cans. We have a trash can back here special for this. Is it still back here?
We've been using the one in the very back.
Oh, got it. Hey, they moved it. Used to be in the alcove. See this big trash can? This is where you're going to throw your trash. That way we've got a lot of people using it, so that's why it's so big. Okay, so that's done. Okay, what's next?
And next we will remove the utility gloves and store them in the plastic bag.
Okay. Let's remove our gloves. And I borrowed these, so I'm going to put them back where I got them.
And then we're going to remove the rest of the remaining PPE and place it in the clinic trash can.
Put this back. So I'm going to remove my mask. I can put this in the clinic trash cans. And I'm going to remove my gown. And that goes in here as well. Those two things you can throw in here. You don't have to put it in the big trash can. Okay?
Wash and dry hands.
Okay, here we go again. We're going to wash. Like I said before, you got to do lots of hand washing. You're going to get really good at it. Fingertips, don't forget that. Always really rub. When you wash, make sure the water runs off your fingertips and not towards your elbows. And dry. And what did we have next?
Now, if we were using our bin, we would go to the back to retrieve it.
Okay. If you had a storage bin, you would go back to your locker because in the time that you treat your patient, you don't have it sitting out. You have it secured in your locker. So you would go get your storage bin. Usually in your storage bin, you're going to put your eyewear, your BP cuff, your stethoscope, pens, pencils, those sorts of things. Stuff that you're going to need when you're in clinic. You store them in that. Okay?
Then we'll return the unit to the correct shutdown position.
Okay, the correct shutdown position is where everything is in alignment. Let's bring the chair up a little bit. That way the cleaning people can get around the chair, the bottom of the chair easily. We're going to grab the paper towel. And we're going to put the rheostat at the bottom of the chair where we found it. Okay, now line this up. We're going to bring our light back around so that it's lined up. We're going to straighten it out. Come around the front of that. Okay, and we'll bring it down a little bit so it doesn't hit the monitor. below. And you can see how it's nicely lined up. Okay? You're going to shut off the unit. In order to do that, you're going to push this button here on the side. This is the unit shut off and on switch. And you're going to push it toward the wall, toward your back wall. And that shuts it off. Okay?
The cart, you want to put the
Cart back over here, lined up. And there's usually a little card in the drawer.
It's under the mouse.
Yeah, that's right. Then we're going to put that we've disinfected this unit, so the room is ready. Just means that it's been prepped, it's ready for the next patient.
And then we usually put that up too.
Thank you, Ms. Turner.
You're welcome.
Okay.
Next, we would retrieve our tray from the...
Okay, I've still got to disinfect it. When our tray would be ready, it would be on the dispensary, the front of the counter here, as well as our suction holder. And we would be able to put those back on the unit where they belong.
Okay. And then just get your instructor to check you out.
Okay. Your instructor does have to check you out, so make sure that you don't leave before the instructor has checked your unit. And that takes care of that. Thank you.